I need to tell you about a phone call I received 3 years ago. It was from the daughter of one of my patients, a woman I will call Dorothy, 79 years old, sharp, independent, lived alone, spoke to her daughter every day by phone. The daughter called me on a Tuesday morning. She was frightened. She said, "Something is wrong with my mother." She did not recognize me on the phone yesterday. She was saying strange things. She sounded confused and scared. I went to see her this morning, and she did not know what day it was. She could not remember my husband's name. She fell twice trying to get to the bathroom. I asked one question: has she had any burning when she goes to the bathroom? Any need to go more often than usual? The daughter thought for a moment. She said, "No, nothing like that." "Why?" I said, "Get her to hospital now. I think I know what this is." Dorothy had a urinary tract infection, a UTI, not a severe one by the usual measurements. A moderate infection in her bladder that in a younger person would have caused a few days of discomfort and been treated with a short course of antibiotics at home. But Dorothy was 79, and in older adults, particularly women over 70, a UTI does not always behave the way most people expect. In Dorothy, it had gone straight to her brain, not because the infection spread to the brain, but because of what an infection does to an older person's body and mind when it takes hold. Dorothy spent 4 days in hospital. She received antibiotics through a drip. She gradually returned to herself. By day 3, she knew her daughter's name again. By day 4, she was asking to go home. She recovered fully, but her daughter told me afterward, "If I had not called you that morning, I would have assumed my mother was having a stroke, or that her dementia had suddenly got much worse. I would not have known what to do." Dorothy did not have dementia. She had a UTI. Today I want to make sure you know the difference. First, let me tell you something that surprises almost everyone. Urinary tract infections are the most common bacterial infection in adults over 65. More common than chest infections, more common than skin infections, more common than most things, and in seniors they are one of the leading causes of emergency hospital admissions. Every single week, in every country, not because UTIs are particularly dangerous in themselves, but because they are so frequently missed, misread, mistaken for something else, until the person is very unwell, and the reason they are missed is simple. In a younger person, a UTI announces itself clearly: burning when you urinate, needing to go urgently and often, lower abdominal discomfort, sometimes a slight fever. The symptoms are unmistakable. The person goes to the doctor, gets antibiotics, gets better. But in seniors over 70, those classic symptoms are often absent, completely absent. No burning, no urgency, no obvious discomfort. Instead, the infection announces itself in ways that nobody connects to the bladder at all. Here is what a UTI actually looks like in an older adult: sudden confusion. This is the most important sign. A person who was perfectly clear-minded yesterday is suddenly muddled today, cannot follow a conversation, saying things that do not make sense, seems disoriented in their own home. This sudden confusion is called acute delirium, and a UTI is one of the most common causes of it in seniors. Not the only cause, but one of the most common, and one of the most treatable. Sudden extreme tiredness. Not the ordinary tiredness of a poor night's sleep, a sudden heaviness, an inability to get up from the chair. A person who was pottering around the house yesterday is barely able to get to the kitchen today. Sudden weakness or unsteadiness on the feet. Falls in seniors with no obvious cause should always prompt a UTI check. The infection affects the whole body's ability to function, including balance and muscle control. A change in behavior, becoming agitated, anxious, withdrawn, or unusually irritable in a way that is out of character, seeming unlike themselves. Decreased appetite, and drinking less than usual. Occasionally a low fever, but not always. In older adults, the body's temperature response to infection is weaker than in younger people. A person can have a significant infection and show only a low-grade temperature or sometimes none at all. And occasionally, when the infection is present for longer, more obvious urinary signs do eventually appear. Needing to go to the toilet more often, urine that smells stronger or looks cloudier than usual. But do not wait for those urinary signs. In many seniors, they never come. The confusion, the falls, and the weakness come first, and by the time obvious urinary symptoms appear, the person may already be significantly unwell. Why does a bladder infection affect the brain? This is the question everyone asks, and it deserves a clear, honest answer. When your body has an infection anywhere, the immune system responds. It sends signals throughout the body saying there is a threat, everyone on alert. One of the effects of this immune response is inflammation, a low level of inflammation spreading through the body and the bloodstream. In a young, healthy brain, this inflammation causes few obvious effects. A young brain is resilient, it has reserves, it manages. But an older brain is different. An older brain already has less reserve, it already processes things more slowly, its blood supply is already less robust, Its protective barriers are already thinner. When inflammation from a UTI reaches an older brain, even through the bloodstream from a distant infection in the bladder, the brain becomes temporarily less able to function normally. Thinking slows, memory falters, orientation gets lost. The person becomes confused, frightened, and unlike themselves. This is not permanent damage. This is a temporary state caused by the inflammation from the infection affecting the brain. When the infection is treated, when the antibiotics do their job, and the inflammation reduces, the brain returns to its normal state. But the window matters enormously. An older brain under sustained inflammation from an untreated infection does not recover as quickly or as fully as it would from a short-lived infection. The longer the UTI goes untreated, the longer the confusion lasts, and the harder the full recovery can be. This is why speed of diagnosis matters so much, and why knowing what to look for matters so much. Who is most at risk? Women are significantly more at risk than men. The anatomy of the female urinary tract means bacteria reach the bladder more easily. After menopause, the hormonal changes that once helped protect the lining of the urinary tract reduce, and as women get older, the risk grows further. But men are not exempt, particularly men with prostate problems. An enlarged prostate can cause incomplete bladder emptying. Urine that stays in the bladder too long becomes a breeding ground for bacteria. People who are less mobile. Movement helps the urinary system flush effectively. People who sit for long periods, who drink too little, or who do not empty the bladder fully are at higher risk. People who use catheters. A urinary catheter, a tube used to drain urine, significantly increases infection risk and requires careful management. People on certain medicines, particularly those that suppress the immune system or affect urinary function, and people who have had UTIs before. A previous UTI is one of the strongest risk factors for another one. What to do when you suspect a UTI? Do not wait and see. In a younger person, waiting a day or two to see if it clears is sometimes reasonable. In an older adult, particularly one who has developed sudden confusion, do not wait. Go to the doctor the same day, or to an urgent care center, or to accident and emergency if the confusion is severe. Say these words clearly. I am concerned this may be a urinary tract infection. I want a urine test done today. A urine test is simple. A sample is taken. It is tested with a dipstick in minutes. If infection is suspected, it is sent for culture to identify the specific bacteria. The dipstick result can guide treatment the same day. Antibiotics can be started immediately, and in most cases the person begins to improve within 24 to 48 hours of starting treatment. The improvement in the confusion, when it is caused by the UTI, is often remarkable and fast. Families describe watching their parent or spouse return to themselves over the course of a single day once treatment is underway. How to reduce the risk of UTIs. This is genuinely important, because UTIs in seniors are not just a one-time event. They tend to recur. The same factors that allowed one infection create the conditions for another. The single most important prevention measure is hydration. Drink more water, every day, more than you think you need. The body's thirst signal weakens with age. Many seniors are mildly dehydrated throughout most of the day without feeling thirsty. Water flushes the urinary system. It dilutes bacteria before they can establish themselves. It keeps the lining of the bladder healthy. 6 to 8 glasses of water a day is the target. Start with a glass in the morning before anything else. Have a glass with every meal. Keep a glass of water visible and accessible throughout the day. This one habit reduces UTI risk significantly. Research consistently supports it, and it costs absolutely nothing. The second measure is complete bladder emptying. Take time when using the toilet. Do not rush. Try to empty the bladder as completely as possible each time. Leaning slightly forward can help. Waiting a moment after you think you have finished and trying again, called double voiding, can help empty the bladder more fully. The third measure is hygiene. Simple, gentle hygiene. Front to back when wiping. Avoiding harsh soaps or products in the genital area that can disrupt the natural protective environment. The fourth measure for women, particularly postmenopausal women, is a conversation with your doctor about vaginal estrogen. A very small amount of localized estrogen applied as a cream or pessary can restore some of the protective lining of the urinary tract that reduces after menopause. Research consistently shows this reduces recurrent UTI rates significantly in postmenopausal women. It is not systemic hormone therapy. It is local, and for women who have repeated UTIs, it can be genuinely life-changing. The fifth measure is not delaying when you need the toilet. Holding urine for extended periods allows bacteria to multiply. Go when you need to go. One more thing before we finish. If someone you care for, a parent, a spouse, a neighbor, suddenly seems confused, falls unexpectedly, or becomes unlike themselves, please add UTI to your mental checklist alongside stroke and other emergencies. It will not always be the answer, but it is common enough that it should always be considered quickly. The question to ask is simple. When did they last urinate? What did it look like? Have they been drinking enough water today? Have they seemed off for the past day or two before this happened? Those questions cost nothing, and the answers might get them to treatment hours earlier than they would otherwise have arrived. Dorothy went home to her daughter after 4 days. She lived independently for 3 more years after that. She died peacefully of an unrelated condition at 82. Her daughter still calls me occasionally. She told me once that she is grateful every time she thinks about that Tuesday morning, that she made the call instead of waiting to see if her mother improved on her own. She said, "I know now that confusion in an older person is a medical emergency until proven otherwise." That is exactly right, and now you know it too. Your action steps from today. 1. Start drinking more water tomorrow morning. A glass when you wake up, a glass with every meal, 6 to 8 glasses every day. This is the most important thing on this list. 2. If you or someone you know develops sudden confusion, sudden falls, or sudden extreme weakness, think UTI. Ask for a urine test the same day. 3. If you are a woman over 60 who has had more than 2 UTIs in the past year, ask your doctor specifically about localized vaginal estrogen. Use those words. 4. Share this video with your family, with your adult children, with anyone who cares for or lives with an older person, because the information in this video could prevent a hospital admission. It could prevent a terrifying few days of confusion that scares an entire family. It could prevent the unnecessary assumption that AB parents' mind is failing when their bladder simply needs treating. Subscribe for new videos every week. I will see you in the next one.